For millennia, right up until the early part of the 20th century, a diagnosis of diabetes was devastating, particularly in childhood when it was usually fatal over a period of weeks to months. There were few effective treatments beyond heroic dietary restrictions requiring meticulous monitoring of calorie intake and glucose excretion combined with extended periods of bed rest. The aim of the severe calorie restriction was to reduce glycosuria, dehydration, and the development of diabetic ketoacidosis, which was a frequent cause of death in children with diabetes. However, the extent of the calorie restriction had to be carefully monitored owing to the negative effect on growth and the ability of the patient to resist and respond to infections. The regimen was unpleasant and difficult to maintain. Consequently, the successful pancreatic extraction of insulin in 1921 was a miraculous, life-changing advance. Initial difficulties in producing large quantities of insulin and the inability to transport it long distances led to the development of localized production capabilities within many countries, helping to spread the benefits of this life-altering treatment far and wide. The short duration of action preparations required frequent injections using glass syringes and relatively big needles that needed sterilizing between uses. However, subsequent improvements in the purification and properties of insulin preparations and also the devices used to deliver them have progressively improved outcomes for patients, reducing side effects such as lipodystrophy and hypoglycemia and reducing the pain and discomfort of injections. Despite these developments, there are challenges that remain. In 1923, Dr. Elliot P. Joslin said, "Insulin is a remedy primarily for the wise and not for the foolish, be they patients or doctors. Everyone knows it requires brains to live long with diabetes, but to use insulin successfully requires more brains." These words still hold true today. Even though numerous diabetes treatment options exist, gaining access to and using insulin optimally to achieve and maintain good glycemic outcomes from day to day while avoiding hypoglycemia, although easier for most, remains a challenge for many patients and providers. In this review, we aim to remind the reader of the truly transformative effect that insulin has had on the lives of patients from the moment of its first successful use to the present day. We highlight the various facets of improvements, including outcomes, formulations, and methods of delivery, and the ongoing challenges through the use of illustrative stories from history and from our own clinical practices.